Hi everyone, this is Dr. Ginger Garner here, and I am back with another pose of the week. Today we are going to be working on bringing the abdominals and the pelvic floor, the muscles in the spine and in the hip, which are important for core stability, like they are core stability, in combination with the voice, because it's part of the 3 diaphragm pressure system as well. I'm going to show you something that you can work on to bring these things online when you have existing pain. When you are, it could be that you're postpartum or you have a hip or a back injury or pain. And you have lots of tightness through here, okay? Tightness here, or what feels like maybe pain down in here, or even up under here, in this area. So the first thing I want you to do is be aware of your breath. You'll need a belt, a strap, a piece of rope, TheraBand tubing. You're going to tie it around the lower part of your rib cage. Pretty tight, because I want you to be able to feel back rib breathing. That's essential. Okay? So tie that on pretty tight. Tight enough where you can feel. So watch me here. I'm not chest breathing. I'm breathing here. Silent and visible up here, but not invisible here. We want bucket handle expansion. When you have bucket handle expansion and no chest heaving up here, okay, then we can unload the pelvic floor a little bit. A regular belly breath is going to load the pelvic floor. Your back rib breath is going to unload the pelvic floor. That's step 1. Step 2. You're going to take the front leg into a 90-degree position like this, okay? Toes to nose, knee and ankle at 90. Hip it looks like it's at 90 here. Same thing with the back leg, okay? Back leg is 90, right? So both legs are coming straight out, okay? This leg, back leg, is coming straight out of the hip. It's not forward, it's back. From this position, if I move this leg out of the way for a second, you can see what my knee is doing. It's straight out, it is not forward. I'm going to sink and lift. This is not on the ground, only this side is on the ground, okay? Sitting bone is lifted in the air on the back leg side. So I'm gonna take the hip and move it back and forward a few times to make sure that when I bring this leg in, it's comfortable. Again, this is floating up here. And you're just gonna lift the knee and put it down. Now we're trying not to do this when you lift the knee, okay? You're going to back rib breathe. And you can reach around to the inside of your sitting bone, not the outside, not on your sitting bone, on the inside of your sitting bone, okay? Not on genitals, but between those and your sitting bone, okay? So right on the inside, and you should feel muscles pop into your fingers. So I can stay relatively still here. I can rib breathe. You can feel my abs kicking in, but not tightness up under the rib cage. You're only gonna experiment with 10 or 12 of these. The next thing that you'll do after all I did was lift the knee this much, okay? The next thing is you should be able to lift your heel. So if I turn to the side, my leg is coming straight out of the hip, right? And that's all I did first. Back rib breathing, isolating that area. Next, can you lift here? And still sit tall, maybe about 10. Next would be trying to lift the knee and the ankle at the same time while sitting tall. So if I turn this way, okay, this is called the side sit series, by the way. If I turn this way, I'm still sitting up tall. This will not rise up. It will stay still. You can lean on a ball You can lean on a yoga block just to bring yourself up a little bit higher. So I'm gonna lean on this ball. I'm gonna look back, keep this hip very still, and lift both at the same time. Making sure that this stays still. Maybe you can get through 2 or 3. Maybe you can't lift at all. That's a goal. Switch to the other side. Toes to nose, that's important. 90-degree angles. Okay, all the way around. 90, 90, 90. 90, 90, 90. If I turn to the side, my knee is coming straight out of the hip, never forward. So 90, 90, and 90. Ankle, hip, knee is a relative 90-degree angle, okay? So not lifting the hip at all, you're gonna get that tiny little knee lift. Hip stays still, I'm back rib breathing, no chest breathing. When I back rib breathe, I'm unloading the pelvic floor. You may only get through 5 or 6 before you need a break. And then, lift the heel. Don't move the hip, just lift the heel. Maybe you get through 5 or 6, maybe 10. Maybe you just imagine it, because if you haven't done these movements in real life activities to strengthen this area, then isolating them is going to be pretty hard. Make sure this leg stays back far enough. And then the last one is sitting up tall. Use a big ball or a block where you can sit up very tall. And the back leg, you're going to try and lift at the same time without, and you really need to be pushing into the block here, without lifting, without doing this, right? So this wouldn't do anything, right? That's not doing anything. It's this isolation, okay? Here. So when I come forward, and you see me sitting tall, this does not move, okay? That's it. Back rib breathing, no chest heaving. All right, that is what I call the side sit series. Okay. Hopefully that's a way to strengthen the core without aggravating an existing hip or pelvic pain. Also a way to improve trunk mobility and integration of the breath with strengthening of the pelvic floor. All right, see you next time.